This is a non-shaven CIT method of FUE. It takes us approximately 30 minutes to trim a donor area for 1,500 grafts and approximately 1 hour for over 3,000 grafts. Once the donor area is trimmed in all 14 regions, which include 8 major regions and 6 minor regions, we apply local anesthesia, one region at a time, and then we begin to extract grafts. Notice that with the extremely sharp surrounded punches, minimal effort is required to incise the skin. The punch may be directed directly down the follicles. There is very little movement of the tissue, and this is in the absence of tumescence. Transection rate in this case was well under 2% throughout the duration of the procedure. As you finish one region, you move to another, and as you finish one part of a region, you move superiorly. This way the blood flow is always out of your operative field or inferiorly. I harvest with the patient in the seated position. Notice once again the punch incises directly down the orientation of the hair follicles. There is no need for traction with your hands in almost all cases. Tumescence does help, as I'll show later in this video, but is often not required. Many times I allow the punch to take a bite into the skin, and once into the skin, I can slide directly down the hair follicles. You can see how fast this method of harvesting is. Indeed, in this instance, all the grafts were harvested in under 2 hours. We oftentimes use suction to help keep the operative field clear. I use a single hair clip to keep the hair out of my way. I oftentimes move left to right or right to left, and then superiorly. I use the tip of the punch to help move the hair out of the way. Here you can see the use of tumescence. I'm using the self-filling injection device to rapidly tumesce the region. This does add skin turgor and facilitates the extraction of the grafts. Here I'll go a little slower. Take a bite into the skin and then pass the punch directly down the direction of hair follicle growth. The learning curve with this method of FUE is extremely short. All you have to do is line the punch up with the direction of hair growth and then insert the punch directly down the direction of hair growth or hair emergence from the skin. This works extremely well in white hair, where we don't need to worry about seeing the hair follicles in the adipose. Typically with white hair, I will dye the tips of the hair follicles to give them some color and help me line my punch up with the direction of hair growth. You see that I use a hair clip to move the hair out of the area that I've already extracted, and then I continue extracting again, moving superiorly so that I keep the blood flow below my operative field. You can also see that with this method of FUE, a minimal depth extraction, There is very little bleeding in many cases, and in fact in almost all cases. There is bleeding. Tumescence certainly helps to control it. This is a non-shaven technique, and you can see just how fast you can extract the hair follicles. This is a patient who can return to work the next day, and he is able to conceal the grafts. Once the grafts are dissected, we just easily slide them out. Now, if you get a tough graft like this, you just apply gentle extraction force and ease the graft out. Bear in mind that all the time that these grafts are being extracted, we are pulling grafts, we're making recipient sites, and we are placing grafts.